Nuat Thai, or traditional Thai massage, is known by people from all around the world and has received recognition as UNESCO's list of the intangible cultural heritage of humanity since the year 2019. Thai traditional medicine has been around for over a millennium. From the Sukhothai period, evidence suggests the existence of medicinal herb gardens on the sacred hills or khao luang for the cultivation of medicinal plants used to treat diseases among the population. But with the appearance and increase of Western medicine, Thai traditional medicine has started receiving less recognition. In the year 1977, the World Health Organization formulated a plan to promote and develop traditional medicine, followed by the adoption of Alma-Ata Declaration and the Declaration of the Goal Health for All. This called for member countries to use traditional medicine and herbal remedies as a part of primary health care. This resulted in an increased role of Thai traditional medicine for public health care. In 2002, the National Health Security Office Act was enacted, ensuring that every Thai citizen has the right to receive healthcare services. To support and provide healthcare services, the National Health Security Fund was established as a financial resource. The Act categorizes healthcare entitlements into three major systems, including Universal Health Coverage Scheme, Social Security Scheme, and Civil Servant Medical Benefit Scheme. Later in 2007, the National Health Security Office added Thai traditional medicine services into the National Health Security Scheme. This coverage includes diagnosis, therapeutic, and rehabilitative services such as Nuat Thai, herbal steam bath, hot herbal compression, postpartum care, and herbal medication. 97 herbal medicines have been listed in the National List of Essential Medicines. Additionally, guidance and recommendations for health maintenance are also provided. As a result, individuals are able to access Thai traditional medicine services from state healthcare units at all levels, which cover over 10,000 healthcare facilities throughout the country. Furthermore, a Thai Traditional Medicine Development Fund was established as a subsidiary fund to enhance access to Thai traditional medicine services. Taking into account the population covered by the Universal Health Coverage Scheme, which amounts to approximately 47.5 million people, it is projected that in the year 2022 there will be a budget allocation of approximately 910.1 million baht to support these services in 2023. Thai traditional medicine services can indeed help reduce healthcare expenses for Thai citizens. In 2022, there were approximately 144.3 million cases of patients receiving these services. Both herbal medicines and herbal products are also widely accepted. The use of herbal medicines in the healthcare system has a significant value estimated at 1,241 million baht, resulting in an increase in value of herbal medicine consumption with a high chance of further development and an increase in economy. So far shown a steady increase in consumption of herbal medicine, where during the year 2022, the value reached over 52,104 million baht, marking an increase of 3,996 million baht compared to the year 2021. Traditional Thai medicine and alternative medicine will serve as complementary healthcare approaches in this era of global transformation. The integration of Thai traditional medical knowledge and wisdom with creative thinking, science, technology, and innovation will create value for our world.